Army. With this development, the many officers of the Nigerian Army remain at risk. The PTF and the Nigeria Center for Disease Control maintains that abiding by safety precaution is the surest way to prevent a further spread of COVID-19. Well, joining me to discuss this is CEO Occupational Health and Safety Managers, Ehi Iden. Good morning. Good morning. Thank you for joining us on TVC Breakfast. We are counting down to the Christmas period, and we have seen a rise in cases since December the 1st. Some people believe that even before December, we had entered the second wave. But in recent days, we have recorded a number of deaths from complications with regards to COVID. And then we see the governor of Lagos State contracting the virus, and now about 26 army generals were said to have contracted the virus from, they went for the meeting, a conference rather, and that was where it was reported because one of the members died recently as a result of complications from COVID-19. I wonder what's your reaction to this recent development, seeing that we are in a second wave?
You know, thank you so much. I think whether we'll be in a second wave was just a matter of time.
Right.
We knew we were going to have a second wave based on the behavior that we saw put up by people, not just... Now we're discussing this even because you just used the right word, high-profile people, right? We're discussing it now because high-profile people who had access to testing kits used that and found out that they were infected. What about the community people who we don't even know? So I think instead of looking at this what has happened within the recent days, it's enough for us to go back and look at what our approach or strategies are in combating COVID-19. Definitely, we knew there would be a second wave of COVID-19. When you take a look at what has happened lately, I mean the governor of Lagos State and the army generals and all have you, then it tells you we have more cases even at the community level that are unreported because they have no access to testing. So we have more cases in Nigeria. What we declare is not the true figure. We're going to have second wave. There's no two ways about it because the behavior of people as workplaces were opened up. I mean, it was so... we're behaving as if COVID-19 has come and gone. I mean, you look at the transportation system, look at the marketplaces, look at the workplaces, look at the worship centers. You just, when you take a look, I mean, do a survey of what's happening in these places, it's obvious that we had the guard when we had the lockdown.
And we let it down.
Exactly, we let it down. Now here we are. So it's sad, but I think what we have seen right now should give us enough reason to do what you call random sampling, in where you have clusters of people like the workplaces, like the churches, the mosques, the marketplaces. Just do random sampling. You'll be shocked of the outcome of those results. Now,
you mentioned something that now we need to make a risk assessment or something of how we have handled the virus over time. And that brings me to the question of risk communication, how it has been over time. If you are to assess it, what were the loopholes? Because the PTF has always said that it is our collective responsibility when it comes to, managing this virus. And a lot of people still do not believe. What are the loopholes in our risk communication that is not driving home the point for people to understand that this virus is deadly?
When you talk of risk communication in healthcare, one of the strongest key ingredients in risk communication is let people know what they have to do and why they have to do what you're telling them to do.
But that's what we have been doing.
Yeah, but let them know what the risk is, what's at stake, and put information to them in a language they understand. We can't just sit here in Lagos and put all the information forth. It's not going to give you the desired results. Let's have community come together, talk about COVID-19. Let's have market women come together, talk about COVID-19. I mean, what stops market women before you start work in the morning? Let's have maybe 5 minutes. They have market in 5 minutes. These are the kind of pockets of discussions that should be energized by government policies, and it becomes what you have to do. The more you reinforce this information, the more people comply to the right and safe behavior. And when you don't comply to right and safe right or safe behavior, one of the key things that drives compliance is consequence. We saw all the buses on the streets, that were violating government protocol. We saw it everywhere, we saw them, but there was no one that had been documented that government used as an example. So what we're seeing right now...
Would that have changed anything?
It would have, because if you now have what you call enforcement agents that stop buses on the road and say, okay, how many passengers do you have? You have 4 on the back row, 4 on the middle row, and 1 in the front. What's the government policy? Government said 50% occupancy,
yes.
But we didn't have that. And they apply on government road, they apply to government houses. So if you cannot enforce your laws, there are no laws.
Right.
There are no laws, because what makes laws bite is enforcement.
But some were saying that will be infringing on the rights of people.
How?
When you say that you're limiting their movement, you are limiting, the capacity of certain buses to carry some people. And
do you know, when you talk of disaster management, you forget about what the normal thing is. Now we have what you call key public health issues. You don't look at what it was or what should have been or what the vehicle was configured to carry. Remember that the government is the custodian of public safety. So it's your responsibility to say, based on what we have seen, every vehicle, you don't have 50% occupancy. That is the law. If you go back to what just happened in a few days in Uganda, that's what the government were trying to do. That we have laws concerning COVID-19 prevention and spread. When you violate it, those who violated those laws, they face the law. But we haven't had that happen here. And that's why, the COVID-19 second wave was not, it wasn't will it happen, when will it come, was just what we were waiting for, because we saw the behavior, we saw the indicators, they were all there, and here we have it now.
Now, from what we are seeing now, because it's a festive period where a lot of people want to move around and interact with people and all of that, do you think that perhaps having another lockdown, which a lot of countries are already facing, might be what would be the way to go? Because we saw the reaction and the impact on the economy when we had the first lockdown. And some countries are already in a lockdown again. Is that something that you think we will be looking at this time? Can we afford it?
It's not a matter if we afford it, but I must first draw a line here that you need healthy people to build the economy. You can't say because you want to grow the economy, everybody's life will be at stake. You need healthy people. A country is only as productive or as prosperous as the head of the people. That's very crucial. But when you go back before let's take a few months back. When the government made the policies, if you go back to Edo State, where you have the the policies, elections were going on.
Yeah, the campaigns.
You saw campaigns.
Yes.
But the same governments that had the policy. So, when you put that body language forth, what you've just done is that you're giving everybody the latitude to relax, and that was what happened. So, even the government, the functions you see, the same government people that made the laws are out there. You told them not to have a handshake. You see them having handshake, having hugs. So, what are we talking about? So, when you want to have a policy, I think the compliance has to start from the top. We didn't get that. It distills down. You see, when compliance starts from the top, it becomes, I have by my body language and by my conduct, I have honored my word.
Leadership by example.
Exactly. It just cascades down. But we didn't see that. But come back to your question, whether it is Christmas or not, because it's going very bad this time, because people converge in beaches, in parties, or what have you. But
which has started already.
We just have to look for, that we didn't go to beach for one Christmas does not change your name from what we used to be. If we have to sacrifice this for the safety of public issues, public health issues, we have to do it. But I think if you ask me, government shouldn't even wait for people to go to the beaches. Government should close down the beaches before people start. Because it's when you have access.
The government should begin looking at areas.
Of course, where you have heavy clusters of people. What you do, just like what I read about the Uganda issue yesterday. Yes. I think that was reactive because government knew that concert was going to hold. If I was a president of that country, I would seal up that concert venue 2 hours for the concert. Because that is being proactive.
Perhaps they wanted to lay an example.
Yeah, but that was reactive. But what about the people that gathered in that place? What if indeed COVID-19 was present in that place? I mean, somebody had it, and what about the spread? You don't have to wait. For me, I'll wait for them to put the concert together. Maybe 30 minutes to the concert, I will seal it up.
Right.
You understand? These are proactive means. So we don't have to wait for people to find their way, or already bought tickets to go to the beaches. People already bought bikini and they want to display them. You're not going to start. You have to stop them before they get there. And I think that's being proactive. That's what we should be doing right now.
Now, you have said that it's going to be worse than what we saw in the first wave, if I am to use the word. So are you saying that the pressure that will come this time around with the number of infections, our healthcare system with the state that it is at this time may not be able to handle it if it is not checked?
If you look at our healthcare system, which of course we said at the outbreak of COVID-19 that it's actually overwhelmed, it's fragile. I mean, that was the word that was used, yes. Fragile healthcare system. But if you noticed, I mean, along the line, people who had COVID-19 didn't even go to the healthcare system anymore because they were just treating themselves at home. And so those were not documented.
Right.
You understand? So there were a lot of cases already in the system that were not captured under the data of NCDC. But a lot of people had COVID-19 at home, they treated themselves. But I think that's what is still going to happen. But in going forward, I mean, in this state that we're in, I'm not sure we have as a country, is what we want to see us go through. The economy on its own, like you said, is already in a very pitiable situation, and now trying to lock down the country again. But this would have been avoided if we did what we ought to do. There would have been no need. I mean, if you go back to the time of Ebola, I mean, that Ebola was really a cause on public health. Ebola came up as a case on its own, and Nigeria was very visible.
Yes, addressing it.
What we did, I mean, it's a case of the that being across the world. If I remembered what we did in Ebola, and let's do the same thing, and everybody stick to their guns, we would have been better off. But we just felt, I mean, even when most economies were opening up, most sectors were opening up, I felt it was too early
for us to do the same.
Yes, I felt, because at that time, we had this discussion. I said that we are putting economy forth before public health, and here we are right now. If we don't do the right thing, we would have come to where we are right now. That's the truth.
Now, if we look at, because that talks again that there is a vaccine, and I can see you're smiling with regards to that.
I'm just looking at my wife, looking at me now, talking about that vaccine because she has an opinion about that vaccine.
A lot of people have opinions with regards to this vaccine, which even in the U.S., there are mixed reactions with regards to it. Yeah. There are still some issues that are not clear to people. And reports stemming from the papers, I think last week, is saying that the government is looking at vaccinating about 20 million people. And even where we do not understand details of this vaccine in terms of the vaccination, how long it would be before there is a need for a reboost or something, and the lifespan, the shelf life, and all of that. What do you see this vaccination? Would it change anything? Do you think that we having this could also be some sort of a light at the end of the tunnel at addressing this issue of the pandemic?
We had this banter on Twitter on this vaccine issue, but I'll just do a summary. What people want is guarantee us of the safety of the vaccine. You know, that's
the long and short of it.
Guarantee us of the safety of the vaccine. You see, a lot of people already there are a lot of conspiracy issues, which of course you know about this COVID-19 and the vaccine, and people do not trust. People seem to have doubt about this vaccine. There are a lot of people, I mean, which of course, we read so many things that came up, I mean, before the vaccine came up, and those who have no business with vaccines became the front driver of the vaccine principle. So it created a whole lot of fear and apprehension and doubts and suspicion in the mind of people. And people have taken positions. Should I take the vaccine? Should I not take the vaccine? And that's why this vaccine issue is not here, it's not there. As of yesterday, I read even the CEO of Pfizer has not taken this vaccine. So if I'm done making this vaccine, I should be the first to take the vaccine. So there are a lot of things, a lot of doubt across the world. Yes, the school of thought, tomorrow's school of thought, they believe this vaccine could come as at least a lifesaver, we can move ahead with our lives. But when it comes with everybody take the vaccine is the issue. Nigeria asked for 20 million doses. What is the population of Nigeria? How much of the population can that cover? So it's a whole lot of issues that nobody is sure of what's happening, and people have their own position.
The major issue is precaution.
Absolutely.
All right, we have to leave the conversation here now. CEO, Occupational Health and Safety Managers, Ehid, and thank you for your time on the program.